care, because when you go in to see your patients, the first time you walk in the room, you need to have information in advance, don't you think, before you walk in the room to see a patient? Do you plan to go on vacation and just land somewhere and don't have any idea what you're expecting? Usually you've done some research and found out different things about the place, you've collected information, and you have made decisions about where you're going to go on your vacation based on this information you're collecting. Same kind of thing with patient care. You want to get information in advance of seeing the patient so that you can come up with an idea of what you expect, what you think you're going to see, what the patient course of treatment is going to be like. And this is going to be based on information that you already know from your studies. Like if you know you're receiving a patient with pneumonia, okay, in report, you're getting a 68-year-old male patient being admitted with left lower lobe pneumonia. So in your head, you start forming a picture of what you think this is going to be like. So what do you think you're going to see? Barry, what do you think you're going to see? What system? What are we thinking about?
Respiratory.
Okay, so do you think you're going to see some respiratory type symptoms? So what do you think? Is this pneumonia a normal process? So you're going to see abnormal, because you learned what a normal respiratory assessment looks like, right? So this is probably going to be some abnormal things. So what would be abnormal in a respiratory assessment that you might think you would see with a patient with pneumonia? Shortness of breath. You think you might get shortness of breath? Okay. What else might you have? You might have abnormal breath sounds. Okay? Maybe wheezing, maybe some crackles, maybe diminished breath sounds. But we're going to have something going on in that lung, so you're not going to have normal breath sounds. And where do you think you would hear the abnormal breath sounds? What side of the lung?
The left.
Left lower lobe, right? Okay, what else might you see? We said shortness of breath, abnormal breath sounds. Okay, we might start seeing some vital signs that are out of whack. Pulse ox. Do you remember what a normal pulse ox is?
100.
95 to 100%. So we might on room air see an 89% pulse ox, which would make you think what? This patient needs supplemental oxygen. Okay, the disease process is causing them to have a little hypoxia. So there isn't enough alveoli available for gas exchange due to what? The pneumonia, the pneumonic process. Okay, so what kind of lab values might you see? What kind of disease process is pneumonia? It's an infection. So you guys have taken microbiology. What do you expect with an infection? Elevated white blood cell count. If somebody has an infection, what else might they have symptom-wise? A temperature. They might have an elevated temperature. They might have an elevated respiratory rate and an elevated heart rate that would correspond with an elevated temperature. Right? Did you learn about that? When your temperature goes up, your heart rate usually goes up a little bit too. So already you have a picture of what this patient might look like. So you can kind of see them in the bed. And now you need to learn, you know what to expect. You need to know how are you going to treat a patient with pneumonia. Certainly the physician is going to give you a set of orders. Certainly antibiotics, do you think would be a course of treatment here? Yes. Supplemental oxygen, maybe IV fluids. This patient might be a little dehydrated from the temperature. Maybe breathing treatment. So we're going to support what the physician orders, but do you think there are things we can do as nurses that facilitate oxygenation? Which we're going to learn about in the course, but you guys have already taken a health assessment course, so you know a little bit about what just one thing do you think you could do to facilitate a patient's oxygenation on your own without a physician's order? Sit the patient up in bed, right? Sitting the patient up in bed is an excellent thing that you could do. So, I mean, there's nursing orders, nursing actions, things that you can do without a physician's order. And then there are, can we on our own administer antibiotics? No. The medical prescription must come from the physician. The nebulized breathing treatment comes from a physician order. Supplemental oxygen comes from a physician order. Okay? So we're going to work in concert with the physician and bring orders together. There's things we're going to do, things the physician will order that we'll carry out. But that's going to be our interventions. So that's how we get started with a plan of care. So we're going to get going into this now. So I want you to go back and remember a couple things. You remember this? Where did you hear this before? 101. Because what we're going to say about the nursing process, and that's with the framework that we use as nurses in order to care for our patients. Does everybody agree with that? All nurses, I don't care where you go to nursing school, you're going to learn the nursing process. It's not just a Mercer County Community College thing. I went to nursing school many, many moons ago when we learned the nursing process. It's what we do as nurses. Your NCLEX exam is formatted around the nursing process. So you need to understand it and really live it every day. The critical thinking competency, because we learned about competencies. What are competencies? Well, how would you define a competency?
Understanding.
Something that you need to master or do very well. Or be able to prove that you know this particular thing. You want to be competent at using an IV pump before you go use it on a patient, correct?
Yes.
So you need to have practiced it, used it, demonstrated that you know how to use it in front of somebody. That's a competency. And then I can record that, yes, this individual can use this pump safely. Because we don't want to hurt patients. So you guys need to practice using the nursing process every week that you see a patient. So that when you graduate, I can certify that you are competent at using the nursing process. And your NCLEX exam will verify that as well. Now that's a good verification, even better than me. So, critical thinking revisited. What knowledge do we need to know to be good practitioners of nursing? What knowledge is necessary? What do you think? Somebody, anybody. Don't make me point to any people. Okay, tell me your name real quick. Joy. What knowledge do you need? Okay, why do we need to know anatomy and physiology? Because when I just said pneumonia, I wanted to know what? What body system? You need to know what body systems or diseases affect. That's important to know. What else do you need to know? Chemistry? Well, okay. Acid-base balance. Yeah, there's some, sodium, potassium. Our body is full of chemical reactions, right? Drugs are chemicals we put in our body. So chemistry is helpful. Even though, not my favorite course. But. Okay, what else? What else do we need to know? Let's get away from the sciences for a minute. What else? What's that? Pharmacology. Why do we need to know pharmacology? Okay, do you want to put a pill into somebody's body and not know how it's going to affect that patient? Is that what you want to do? It's an awesome responsibility handing somebody a cup of 15 pills. I mean, you need to know how they are going to act on that patient's system and how they're going to react with each other. Because they could turn into another totally different substance. We have to monitor that along with the physician, along with the pharmacist. We're not alone in all of this. But we need to have a lot of knowledge. Do you agree with that? Yes. All those textbooks that you need for nursing, along with the sciences that back us up, like chemistry and anatomy and micro and math. Because you do need to know how to figure out dosage calculation, or you can kill a patient. And I don't think anybody wants to do that, right? That's not why you're sitting here. You want to help, not hurt. So everybody's in agreement you need knowledge.
Yes.
Okay? What about experience? Do we need experience?
Absolutely.
What kind of experience do you guys have? Not much right now, right? But we said every week you're going to build. Do you think, like from the time I've been to nursing school till now, how many patient contact experiences have I had? And I soak them all in and I remember them. And when I see a patient with CHF, I don't have to look at a book. I know already what I expect to see with that patient because I've taken care of so many. And you got a question?
Yeah, I got a statement. Like, I was just getting my hepatitis shot the other day, and I went in the nursing the office, and there was such a bad communication among the staff. It took 3 hours for me not to get a shot. So I say communication is like one of the #1 things.
Well, I will say communication is, when we talk about safety in nursing and in healthcare in general, communication is a big factor. And yes, we do need to all communicate well. And are there issues? Absolutely. And it's something as a professional